Osteogenesis imperfecta is one of the most common deficiencies in collagen synthesis, occurring in about 1 in 10,000 people. Therefore, it's also the most commonly tested. This is also called brittle bone disease, since it prevents the synthesis of type 1 collagen, which is a key component of bones. Since there are several different genes involved in collagen synthesis, there are a variety of genetic defects that can result in osteogenesis imperfecta. The most common viable form is autosomal dominant. Patients with OI can present with multiple bone fractures without a history of trauma, including during birth. This is often confused with child abuse, and you may have to differentiate between the two in your exam. Patients may also have blue sclera, since the connective tissue over the choroidal veins is more transparent, allowing the blue veins to be visible, which you can see in this image. Since the middle ear bones are required for hearing, patients may have hearing loss as well, since those bones don't form properly. Lastly, patients have dental imperfections, since they can't synthesize dentin properly. Alright, let's go through a couple questions before moving on to the next section. We'll start with this one. A young father brings his 16-month-old son to the emergency department for the third time in 6 months. The toddler has a non-healing wound in his right knee that originated after a fall 10 days ago. According to the father, the previous clinical visits also resulted from falls in which the child incurred multiple broken bones in his wrist and tibia. Physical examination reveals blue sclera and an abnormal posture. It is noted that the child does not react to conversation. Which of the following is the underlying factor in this child's diagnosis? So go ahead and pause the video if you want some time to think about this. Okay, so what's going on here? Well, you've got a kid who is repeatedly breaking bones, which can either mean one of two things. He's being abused, or his bones are easily breakable. The giveaway here is the blue sclera, which you would not see in child abuse, but you do see in a certain disease that makes you prone to breaking bones. In fact, it has the nickname brittle bone disease. So the answer here is choice D, a defect in type 1 collagen, which is osteogenesis imperfecta. Remember, type 1 collagen is the type you should associate with bones. And by the way, how does the child not responding to conversation tie into this? Well, remember, there are bones in your ears that you need to hear, so this is in reference to the hearing deficiency that comes with osteogenesis imperfecta.